you asked me earlier about the technology side of what I do. And we knew, for example, that in order to stop vector-borne diseases like mosquito-borne diseases like dengue or Zika or malaria and so on, those really get contained locally. But the problem is there's a contradiction because those very local context-dependent conditions, the folks in a little county in rural Texas or Alabama in the United States, or they don't have the statistical skills to add statistical packages to the software, or they don't have mapping skills to add to the mapping to the software. So it all has to be made. They have to be empowered to be able to use the tool through good design. And I guess that's why people like Jade would come into the picture. Good design would be, what is the lowest level of skill set that would allow this tool to be used? And the way we started thinking about it was, well, most folks, even in rural conditions nowadays, can use a smartphone. Mm-hmm. And so they know how to click and press, and they know how to, so that's about the level. But don't ask for somebody to do the statistical software. But the converse of that is those folks don't have the resources to purchase your tool that has all those capabilities. So it's a very difficult balancing act, because the CDC and NIH and all these folks who deal with the World Health Organization, they're dealing with things at the 30,000 foot level. But a lot of their recommendations and a lot of their suggestions have to get implemented at the really, really local level. And those folks can't adapt those tools. And I think I'm trying to give an example that's similar to yours. They can't adapt those tools to be used at this local level. Very difficult for them.